Welcome to this clinical walkthrough on a pregnancy planning with hypertension case for UKMLA, brought to you by Mediate, your 24/7 practice partner.
All right, let's dive right in. Picture this. You're in your UKMLA or PLAB 2 exam, the timer starts, and a 42-year-old patient looks at you and asks this exact question. This kind of scenario is such a classic. It's not just testing your clinical knowledge, it's a huge test of your communication skills and, honestly, your ability to plan safely. So let's break down exactly how you're going to ace this.
So to make sure we don't miss a thing, we're going to use a simple structure, the CARE framework. That's clarify, assess, reassure, and educate. Think of it as your safety net. It keeps your consultation logical, it keeps it patient-centered, and most importantly, under the stress of an exam, it's going to keep you on track so you can tick all those boxes and hit every single key marking point.
Okay, first up is C for clarify. Now, the temptation is to just jump straight into the medical questions, right? But hold on. Before we do any of that, we really need to understand the why. What's behind her request? This first step is so important for building that initial rapport. It shows the examiner and the patient that you see a person, not just a set of clinical problems.
And you've got to be really sensitive here. You might be wondering, is she recently married? Is she feeling that pressure because of her age? You can't just ask that directly. Instead, a really gentle, open question like, can I ask, is there a particular reason you're thinking about this now? Works wonders. It gives her the space to share her story, and that gives you absolutely crucial context for the rest of the consultation.
All right, so once you've got a feel for her motivations, we can move on to A for assessment. Now we're getting into the nitty-gritty. This is where we systematically gather all the facts we need to build a really complete picture of her health and, of course, any potential risks that might come with a pregnancy.
So here's our game plan for the assessment part. Just think of it like a checklist to make sure you don't miss anything. We're going to cover her pregnancy and menstrual history, check her contraception, dig into her medical history, run through that classic PMA Phaedosa mnemonic for a full systems review, and then, really importantly, we're going to verbalize the key examinations you'd want to do.
You've got to be super systematic here. So you'll ask about previous pregnancies, any miscarriages. That helps you understand her fertility history. You absolutely have to check her contraception because you need to know if she's protected right now. And then the big one, get all the details about her hypertension, and especially that Captopril prescription. Honestly, that's the central issue we're going to have to manage.
And please, don't forget PMF-TOSA. I know it's a mouthful, but this mnemonic is your best friend in an OSCE. It's your safety net. It just makes sure you've covered all your bases. Past medical history, medications, allergies, family history, tobacco and alcohol, obstetric history, and her social support. It's just a fantastic, quick way to be thorough and not miss anything.
Now remember, in an OSCE or a UKMLA station, you're not actually going to be examining the patient, but you have to say what you would do. So you'd verbalize it clearly. Something like, based on what you've told me, I'd like to check your blood pressure and also calculate your BMI. This is so important because it shows the examiner you're linking the history you just took to a physical assessment of her risks.
Okay, so you've just asked a ton of personal and medical questions. That can be pretty worrying for a patient, right? So now it's time for the R in our framework, reassure. And listen, this isn't just about being nice. This is a core clinical skill. Building that trust is what makes it so much more likely that she'll actually follow the plan you make together.
You want to use language that really validates her decision to come and see you. Something simple like this. It immediately frames what she's doing in a positive light. You're telling her she's being responsible by planning ahead. And trust me, that's a really powerful way to ease any anxiety she's probably feeling.
The goal here is a bit of a balancing act. You have to be honest, but you can't be alarming. So, you absolutely need to acknowledge the challenges, her age and her hypertension, but the key is to frame them as things we can manage with careful planning. This shows her that you're taking her concerns seriously, but also that you've got a clear plan to tackle them.
And that brings us to E, educate and plan. This is, without a doubt, the most critical part of the whole consultation. This is where you pull everything together, everything you've learned from her, and turn it into clear, safe, and actionable advice.
Now there is one point you have to be absolutely crystal clear about. Captopril. It's an ACE inhibitor, and it is not safe during pregnancy. End of story. And you need to explain why. You have to tell her it can cause serious, serious harm to a developing baby. Don't beat around the bush. Be direct. This is a massive patient safety issue.
So the message for the patient has to be really simple. The Captopril has to be stopped before she even thinks about trying to conceive. Then you can tell her about the safe alternative we'll be aiming for, which is usually a medication like labetalol, of course after a specialist review. Having this clear unsafe versus safe contrast makes it so much easier for her to understand the change we need to make.
So let's break down the immediate plan into 4 super clear steps for her. Number 1, and this is the most important thing, she must continue her contraception for now. Number 2, you're going to refer her to a specialist. 3, you'll explain the plan to eventually switch her medication. And number 4, you empower her with some lifestyle changes she can literally start doing today.
You know, delivering these steps clearly and smoothly when you're under exam pressure, that's a skill in itself. And the only way to build that confidence is to practice. So, just a reminder, you can practice this exact case right now and get objective feedback on mymediate.com. Okay, so what about those lifestyle changes? This is the proactive stuff you can advise her on while she's waiting for that specialist appointment. It's great because it empowers her and it just shows really good patient care. We're talking about things like a heart-healthy, low-salt diet, staying active, and, this is a big one, starting folic acid right away, before she tries to get pregnant. These are all things she can control that will make a real difference.
And please, whatever you do, do not finish this consultation without some critical safety netting. It's so important. She needs to know exactly when to come back urgently. For example, if she feels unwell with symptoms of high blood pressure, headaches, dizziness. And the number 1 red flag, if she becomes pregnant unexpectedly, she has to contact you immediately. We need to get that Captopril stopped straight away.
Finally, you want to end on a really positive and empowering note. A closing statement like this just reinforces that her decision to plan ahead was absolutely the right thing to do. It means she'll leave the room feeling supported, clear on what happens next, and confident that she's on the right track. So there you have it, the complete framework for tackling this case. But knowing it is one thing, doing it smoothly is another. The absolute best way to master this consultation is to practice it, and you can do that right now on mymediate.com.